Periodontitis is a serious gum disease that can cause tooth loss, increased risk of heart attack, stroke, and other health problems by destroying the connective tissue and soft tissue and bone that supports one's teeth. There are three major categories of periodontitis: chronic, aggressive, and disease-related. Chronic periodontitis, also known as adult periodontitis, is a slowly progressive disease that begins during childhood and becomes most aggressive throughout one's mid-30s. Aggressive periodontitis, or early onset periodontitis, on the other hand, may occur during or before one's puberty and is also known as juvenile periodontitis. However, if it occurs during one's early 20s or 30s, it is called rapidly progressive. The last category is disease-related, and according to New York Times, AIDS and Down syndrome are two of the most common diseases associated with periodontitis. Periodontitis is not just caused by one factor. First, plaque and tartar have to build up around the base of the teeth to inflame the gums, and then pockets begin to form after the gums have been inflamed for some time. The pockets form between the teeth and the gums and fill with not only the plaque and the tartar, Medline Plus says, but also with disease-causing microorganisms. There are over 350 microorganisms in the normal, healthy mouth. Periodontitis has only been linked to less than 5%. This means that the microorganisms have to evolve for the periodontitis to occur. According to MGCCC's microbiology book, periodontitis is only caused by gram-negative anaerobes, and streptococci is one of them. One of the most common microbiota found in periodontitis is P. gingivalis. P. gingivalis is not only essential for periodontitis, but a very destructive bacteria that invades the gum cells and causes them to release enzymes that further decay the connective tissue and bone around the teeth. There are several symptoms that come with periodontitis. According to Mayo Clinic, they include inflamed gums, bad breath, loose teeth, new spaces between the teeth, pus-filled gums, or even gums that are receding away from the teeth. As far as treatments go, oral antibiotics are rarely used due to the fact that microorganisms can mutate and become resistant. One of the most common treatments, however, is tooth planing. Tooth planing is where the dentist will go down to the roots of the teeth and scrape along the teeth underneath the gums so that the bacteria will not stick. If the periodontitis has too far advanced, one may even have to have bone or tissue grafts. The last thing one needs to know about periodontitis is how to prevent it, which is mostly by good oral hygiene, of course. Brushing at least twice a day and flossing is crucial in the prevention because it clears most of the buildup of bacteria and plaque from the teeth. Routine visits to the dentist also help in the prevention process due to the fact that the dentists are able to clear the buildup that is not normally removed when one's brushing and flossing occurs. Finally, dentist professionals suggest in changing one's toothbrush every 1 to 3 months due to the fact that the bristles become ineffective and bacteria may breed on the brush. Though one may take every precaution possible for periodontitis, continual visits to the dentist's office will ensure that periodontitis is prevented.